Hi everyone, I'm Dr. Samir Undavia, a facial plastic surgeon in Princeton, New Jersey, and today I wanted to talk to you about the different causes of septal perforation. So first of all, a septal perforation is simply a hole in the nasal septum and can be very distressing to patients. It can cause nasal obstruction, pain, recurrent infections, nosebleeds, and whistling from the nose. It can also result in a saddle nose deformity, which is a loss in the height of the dorsum of the nose. So how do septal perforations happen? By far, the most common reason is previous nasal surgery, and in particular, septoplasty. And even though it's the most common reason, it's still a pretty rare complication. It occurs during elevation of the mucosal flaps in order to get to the deviated parts of the septum. If there's a tear in the mucosa on both sides of the septum at the same location, then a through-and-through hole can form. And that's why all these tears should be fixed at the time of the original surgery, to prevent this type of complication. Then the second most common reason is the use of topical nasal sprays and intranasal drug use. So simple things like Flonase, Nasonex, Afrin, Neosynephrine can all result in thinning of the nasal mucosa, loss of blood supply, and a subsequent perforation. This usually occurs over prolonged periods of time, but it can paradoxically happen with short-term use also, but that's pretty rare. The perforations are almost always preceded by nosebleeds. So if you or someone you know is having nosebleeds and using nasal sprays, have them seen by a physician and have them stop those nasal sprays. Intranasal drug use like cocaine can also cause septal perforations because it's such a powerful vasoconstrictor, and that cuts off the blood supply to the nasal septum, and it results in a septal perforation even with very short-term use. Also, excessive cauterization of the nasal septum for nosebleeds has also been known to cause septal perforations because the blood supply to that septum in that area has been altered. And finally, connective tissue diseases like Wegener's granulomatosis can also result in changes to the microvasculature and damage to that, and that can result in septal perforations as well. So why is it important to identify these causes of the septal perforation? Most importantly, if there's something that's a chronic problem like a connective tissue disease or a chronic intranasal medication use, then these things need to be addressed and corrected prior to fixing the perforation. Because if we don't fix them, then the perforation can likely recur after surgery. So I hope that was informative. If you have any questions about septal perforation or have a perforation that you want evaluated, call us at 609-403-8840. You can also email me direct questions and pictures if you have them to info@drundavia.com. Since I have patients come to me from all over the northeastern United States, it's helpful to have medical records and endoscopic pictures sent to my email. That way, if there's an issue that needs to be addressed prior to making the trip to New Jersey, it can be taken care of beforehand, so it saves you time and hassle.